Dive into the world of medicine with the Patient's Guide podcast, where we simplify the science and uncover the research behind medical topics.
Hey everyone, welcome back. Ready to dive into something that's a little different, but affects a surprising number of people. We're talking adult spinal deformity. You brought a seminar on this, and wow, some of those stats are alarming.
Yeah, it's one of those things people don't realize how common it is. Did you know somewhere between 32 and 68% of people over 65 are dealing with this? That's a huge chunk of the population.
It's way more than just, oh, my back aches. Yeah.
We often just brush off back pain as a normal part of aging, but this seminar suggests it could be something more serious.
It's not always just about age, is it?
No, not at all. Obviously, age is a factor, but there's this misconception that it's just wear and tear over time.
What else plays a role?
The seminar talks about how past injuries can make a difference, even surgeries you've had, and then your lifestyle in general.
Okay, so walk us through this. How do these things actually affect our spines as we get older?
Think of your spine like a machine, right? With all these different parts that need to work together. Your spine's incredibly strong. It's designed to protect your spinal cord and allow for movement. But over time, those parts can wear down, just like anything else.
Where does the problem start?
It usually starts with the discs. You know those little cushions between each vertebra? They act as shock absorbers, letting your spine bend and twist. But over time, those discs can degenerate, like a car tire losing its tread. They lose their flexibility and can't absorb shock as well.
So the discs are like the wear and tear point, and then that impacts everything else.
As those discs wear down, it puts more stress on the vertebrae themselves. Those bones can shift out of alignment, and the muscles surrounding your spine. They start working overtime to compensate. All of that together can lead to spinal deformity.
And I bet that's where things get tricky for a lot of people, right? They just think, my back hurts, it's probably nothing.
One of the biggest challenges with adult spinal deformity is that it's often mistaken for general back pain, which can lead to delayed diagnosis and treatment.
That's where it gets really interesting, because it's not just, oh, you have adult spinal deformity, end of story. This seminar goes into the different types.
There are a few different ways this can play out, and it usually affects the lower back, and the causes can be a mix of things: disc degeneration, muscle imbalances, even genetics.
It's like your body just decides one day, hey, let's curve the spine a bit.
And sometimes it's not clear exactly why it happens. We don't always have all the answers, and this can affect any part of the spine, not just the lower back.
That's wild. Diagnosing this must be way more complex than just like looking at an x-ray.
X-rays are still important, don't get me wrong, but this seminar really emphasizes a more holistic approach.
What does a holistic approach to spinal deformity look like?
It means looking beyond just the bones. Doctors are now considering a patient's entire alignment, their muscle balance, even how they move in their daily life.
So it's not just about what your spine looks like in a picture, but how your whole body's working together.
It's about connecting the dots between those aches and pains and how your body's actually functioning. And you mentioned new technologies. They're playing a bigger role too.
What kind of tech are we talking about?
There are advanced imaging techniques like CT scans and MRIs. Those provide really detailed images of the spine. But there's also a renewed focus on something pretty simple: observation.
Wait, like just watching how someone walks around?
Doctors are paying close attention to how patients walk, stand, bend, all of it. They're looking for clues in those movements, anything that might be a red flag. Surgery is often necessary, especially for those with more severe cases.
Spinal surgery sounds pretty intense.
I get it, it's a big deal. But the good news is surgical techniques have improved so much. They're way less invasive than they used to be, and the focus now is really on preserving the spine's natural structure.
That's reassuring to hear. The seminar mentions something called a simplified osteotomy classification system.
That's basically a new way to classify how complex a spinal surgery is. They use a scale from 1 to 6, with 1 being the simplest and 6 the most complex. It's all about personalized care, really.
Which makes sense, because even with all the advancements in medicine, none of it matters if people can't actually get the help they need.
Exactly. And unfortunately, where you live and your socioeconomic status can play a big role in whether you get diagnosed and treated properly.
Which is mind-blowing, right? A spine is a spine, no matter where you're from.
But the seminar highlights how access to healthcare, nutrition, even things like vitamin D deficiency can impact spinal health and surgical outcomes. We need a more holistic approach to the entire system.
With all this amazing research and technology, what does the future hold for treating spinal deformities?
There's a lot of potential out there.
It really does feel like we're on the brink of some major breakthroughs. But like you said, access is everything. And this seminar doesn't just point out the problem, it actually calls for a more standardized approach to care worldwide.
Yeah, they're really advocating for a more equitable system.
Because a spine is a spine, right? The
Yeah,
science doesn't change depending on where you live.
exactly. It's about improving spinal health for everyone, everywhere. When we share knowledge and resources, the whole field benefits.
So someone listening to this might be thinking, okay, this is a lot. What's the main thing I should take away from all of this?
Don't ignore your spinal health. If you're dealing with back pain, talk to your doctor, get it checked out. Early intervention is key.
It's about being proactive, taking charge of your own health.
And while there are no guarantees, the research does highlight some important factors.
Okay, like what? Spill the secrets.
We've talked about vitamin D, which is crucial for bone health. But maintaining good posture, staying active, and a healthy weight are all important too.
It's funny how we forget about the simple stuff.
But seriously, those everyday choices can make a big difference, especially as we age.
It's like investing in your future self, one good posture habit at a time. Well, on that note, I think it's time to wrap up this dive into adult spinal deformity. We covered a lot, from the different types to the latest in treatment and the challenges of access.
Hopefully, our listeners are walking away feeling more informed and empowered to take care of their spine.
And as we sign off, here's a final thought. What if those simple things, good posture, enough vitamin D, could be the key to preventing more serious spinal problems down the road? Thanks for joining us on this deep dive. Until next time.
If you enjoyed this episode of The Patient's Guide, you can find more below.